New Disabled South presents.
My story, it started when I was a little bit younger, and through sexual abuse by my father, 4 times a week for 6 years.
In North Carolina, where more than 530,000 people are dually eligible for Medicare and Medicaid, survival often comes at the cost of dignity. For one woman, that story began long before disability benefits, when silence was demanded and abuse was normalized. Her journey from childhood trauma to nursing home abuse to fighting for the right to keep her Medicaid today reveals not just a personal battle, but a system designed to disempower, confuse, and endanger. At 70, she's learned that in a system built on silence, speaking up is the only way to survive. I'm Stacey Abrams, and this is Dual, the true cost of care.
Dual, the true cost of care. I didn't realize I was going into a nursing home.
She carried the weight of childhood sexual abuse into adulthood, and later, scoliosis that made walking and standing increasingly painful. For years, she worked as a nurse, covered by TRICARE through her husband's military service. But when her husband died, everything changed.
After he passed away, I was scammed. Yeah, I lost everything. I was put into a nursing home, and that's where the Medicaid started. I never saw a doctor. Yeah, I went to social services because I had been trying to find a place to live.
Desperate for housing, she went to social services in Durham. Everyone told her it would take a year to find a place. She didn't have a year.
So went to social services downtown Durham, saw a lady there. She put me in Trayburn. In order to stay in these places, this happens in all nursing homes, you have to have Medicaid if you're long-term. I didn't realize I was going to be long-term.
What she found instead was institutionalization and a system that made decisions without her knowledge or consent. In North Carolina, just 1% of dual-eligible individuals use institutional long-term care, one of the lowest rates in the nation. But fewer than 1 in 5 have access to home and community-based services that could keep them out of institutions.
There was just too much. It was abuse, a lot of mental and verbal abuse. People died unnecessarily. I went to the hospital and everything. When I told them I didn't feel safe, they said, well, you're not going back there.
The hospital helped her find another facility, but the pattern of control continued.
They put me in a room with another lady that was very controlling. And it wasn't until I went back to the office and found out that that they were my rep payee. That's when I found out about the Medicaid and stuff. And I said, well, I didn't tell you to be my rep payee.
It was 2019 when she discovered that not only had someone enrolled her in Medicaid without her knowledge, but they had also made themselves her representative payee, controlling her Social Security benefits without her consent.
I had no idea.
It was cruelty.
Her Medicaid coverage provided a lifeline to housing, food, and medical care. But it also tied her to institutions that neglected and abused residents with impunity.
So I was the bad person. And I was asked, why are you causing all this trouble? And I also had been touched by a nurse, my breast and in between my legs. I went to the doctor's office, and they said it was considered sexual abuse. So they called the police and everything. It was a lot of cruelty and stuff.
Her story reflects a broader crisis. Investigations across the country have found widespread abuse in nursing homes, enabled by underfunded oversight and fractured accountability. But she refused to be silenced. With the help of an advocate from Disability Rights North Carolina, she fought back against the facility's retaliation and false claims to Social Security.
Well, I knew that I would be able to make it with the help of the Medicaid. I would have been gone a long time ago.
Her survival depended on programs that provided the barest minimum. In North Carolina, the average dual-eligible enrollee lives on less than $1,700 a month, income the government refuses to classify as poverty level.
Well, it's housing, plus food, being able to pay the electricity bill. Yeah, I wouldn't be able to get a doctor. I wouldn't be able to afford my medicine. I would just go to the shelter, live there, and save up my money. My income, I am poverty.
More than half of North Carolina's duals, 53%, are in traditional Medicare and Medicaid fee-for-service, a fragmented arrangement that forces them to navigate two separate systems with little coordination. For her, it meant constant fear.
I fought like crazy in that nursing home to stay alive. I was scared that somebody was going to kill me because they would, I was threatened by a patient 3 times that she said she was going to kill me. Having in the room with another lady, the nursing staff didn't care. She was having trouble breathing, and we were calling for help. This woman, she ended up dying, and I called her daughter and stuff and told her what was going on because she was having trouble breathing. These nursing homes have got to be held accountable. Every one of them need to be held accountable for everything they're doing. And the more people that die, the more deaths they're going to have on their head.
We can change the laws.
Today, she's 70 years old, living independently, but still fighting to keep her Medicaid coverage as politicians threaten the programs that keep her alive.
The people that are helping me out, they're going to lose their jobs. Healthcare has gone down from 100 to, I'd say, 25.
Her doctors are leaving because of funding cuts. The neurologist who provided Botox injections for her movement disorder, the only one she trusted, decided to leave because of new healthcare rules.
That's what Trump does. He's lying through his teeth. And people that voted for him, they're getting mad. And then the others, people that don't give a hoot, they're still going to support him. But they are going to find out at a certain point exactly what he has done when they get older.
Across the country, 61% of dual-eligible individuals use at least one Medicaid wraparound service, like dental, vision, or transportation. In North Carolina, only 30% use vision care, 32% use dental care, and just 11% use transportation. For thousands, that means missed appointments, untreated pain, and preventable hospitalizations. But her message is clear. Survival requires fighting back.
I keep track of what's going on, and people should do the same thing. Some people just are getting fed up and don't want to watch the news, but it's vital for them to do that. And if you're going through a problem, get out there and ask for help. Our whole system has gone downhill, so we need to fight together. Don't be afraid to ask and stand up for your rights. Stand up on your own 2 feet. Be proud of who you are. Don't be afraid. Don't be ashamed of what you are. We can change the laws.
She's been fighting since childhood, surviving abuse that the system failed to stop, surviving institutions designed to silence her, surviving politicians who would steal from the programs that keep vulnerable people alive.
I am 70 and I'm proud of it. People have got to understand exactly what the government is doing. The Republican Party is running this country, and they've got to be stopped.
I don't know how to stop fighting.
This 70-year-old woman's journey through North Carolina's dual eligibility system reveals how trauma and institutional failure intersect to create cycles of abuse. In a state where strangers could enroll her in Medicaid, claim her benefits, and decide she belonged in an institution where people died of neglect, her survival has always depended on speaking up. Now, with just $1,692 a month keeping her housed and medicated, she faces new threats from politicians determined to gut the very programs that saved her life.
But we have to stick together and not be afraid. And that's exactly what I've been doing. I don't know how to stop fighting.
Her words echo beyond North Carolina, beyond dual eligibility, beyond any single program. In a nation where the most vulnerable are expected to be grateful for the bare minimum, her voice reminds us that dignity isn't a privilege. It's a right worth fighting for, even when the fight never ends.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, visit dualcostofcare.com.